Test 1, 2. Committee for Wednesday, February 4th.
Thank you. This meeting is being conducted virtually and in person, so I will do a roll call of the trustees to confirm attendance. Ms. Ginsburg.
Here.
Mr. Razzo. Ms. Langton.
Here.
Mr. Rue. Ms. Fessler. Mr. Pantoja. Mr. Green. Mr. Moore.
Here.
Mr. Kehoe. Mr. Harris. Chair Robbins.
Here.
Staff participating in the meeting include Acting CEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, Director Retiree Healthcare Cassandra Smith, Consultants Stephen Murphy and Michael Zito from Siegel. Trustees, please use the raise your hand Zoom option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda. And there were no requests received for teleconference meeting attendance under SB 707.
Thank you very much. Item 3A, approval of the minutes of the meeting of December 3rd.
So move.
I'll second it.
Yes. Ms. Langton?
Mr. Robbins and Ms. Lang. That's it. We need one more.
I thought we only needed 3.
We need 3.
The more-
We need one more before we can approve the minutes.
Isn't he?
Who?
Is Mr. Moore not on?
All right, we'll approve the minutes when we get a third body here. So
Is he?
I thought he was.
My
My
mistake.
mistake.
Is he?
we'll go
No,
on to 4
he's
public
not.
comment.
Mr. Keogh's on his way. Okay.
I don't see anybody here from the public wishing to address the committee. We don't have any requests in writing. So item number 5, non-consent items. Steve, you're up at 2026-27 plan year premiums.
Thank you very much.
The good news and the bad news.
Just call it news. So thank you very much. We're going to provide some background and context with regard to kind of renewals. So where LACERA sits relative to the rest of the country. And then Cassandra and I will work through the rest of the material just to kind of show you the changes by carrier and how that works. But 2026 is projected to be probably the highest increase in health insurance premiums in probably the last decade. A combination of factors are contributing to that. We have increased hospitalization expenses, workforce shortages, labor strikes, consolidation of healthcare providers. So it's all that's contributing to kind of higher costs. So medical on its own, nationally, we're looking at least somewhere between a 9 to 11% increase. And then from a pharmaceutical perspective, we've talked about this before. We're seeing the influx of single source medications, which are geared towards treating specific conditions. And that's pushing the costs up to about 11%. So you combine those 2 items together, we're looking roughly somewhere in between like 10 to 12% increases nationally for healthcare. On top of that, LACERA has some unique profiles that's different from kind of a standard group, which we typically would think of like an employer group where you've got kind of families, et cetera. This is a group of retirees. So what that does is that contributes to more advanced chronic conditions, cancer cases. So again, we're seeing some of that higher end expenses that you might not see kind of earlier in one's tenure or career. We have the increase in the Anthem lifetime maximum for plans 1 and 2 and prudent buyer. That's going to increase from 1.5 to 2.25 million effective July 1st. We also have some recent changes in Kaiser's underwriting profile. They are changing across their entire platform. So there's some changes that LACERA is dealing with. We're probably on the leading edge of those changes, but it did impact some of the renewal projections from Kaiser that we worked with. And then probably more importantly, or a significant component is Centers for Medicare and Medicaid Services has changed the reimbursement schedules with different Medicare Advantage plans. And that would include Kaiser Senior Advantage, SCAN, and United Healthcare. So in essence, what CMS is doing is reimbursing less than they used to in the past. They're trying to equalize Medicare Advantage plans with traditional Medicare and not trying to overspend on the Medicare Advantage side. What that means is there's less funds going to those Medicare Advantage plans. And so the premiums are having to rise to offset those deficits. Difficult challenge is Medicare Advantage now represents probably more than 50% of all enrollment. So again, it's not going away. It's a component that we're all going to be working with, but it does kind of push those premiums up a little bit more quickly than it has historically. So kind of looking at those factors, that's kind of the backdrop. So again, double-digit increases is kind of what we anticipated. We'd actually, through the budget process, working with Cassandra and the county, projected an increase of about 11.5%. That was back in kind of early fall. And we started the renewal process in October. And when we got the preliminary renewals, the actual aggregate increase across all plans for all participants was roughly 11.7%. So even a little bit north of what we thought it might be. We spent November and December doing a lot of back and forth negotiations with the carriers. And then we actually spent a day with each carrier, spent a day with the carriers in January, kind of going over their renewals and kind of fine tuning the renewal. Through that process, we were able to kind of negotiate the renewal down from the 11.7 starting point down to 9.09%. So in essence, healthcare costs are going to rise about $82 million, again, across for the program. Through the negotiations, we were able to kind of trim that back in terms of avoided costs, roughly about $24.4 million. So that kind of gives you a sense of kind of where we're at. But again, we kind of started at the starting point where we thought we would be, and we're able to kind of bring that down a little bit lower. And we'll continue to work with the vendors as we go forward through partnerships. But Cassandra, I'll turn it over to you to kind of walk through the individual carrier renewals.
Thank you. It is at the committee's pleasure. Do you want to go through overall at each one of the plans individually? We do provide an individual increase amount by plan to let you know which specific plans increased at a certain percentage. That is one of the questions that we get from the retirees. So overall for Anthem Blue Cross, as you will see in the memo, it was 9.1% increase. Would you like me to break it down plan 1, 2, 3, or you're okay with overall?
I'm okay with overall.
Mr.
I don't care, so.
Okay, so we'll do the overall, and if there's one specifically that you want to go individually, just let me know. Cigna had an increase of 12.3% overall. Cigna Dental had a 0.1% increase. Kaiser overall increase was 9.5%. And the out-of-state plans was an increase of 3.6%. Scan had an actual decrease of 0.1%. And United Health, again, had an increase of 12.7%. So that's how we arrived at the 9%. You might wonder why some of these plans show a higher percentage, but we ended up with 9%. That's because it's a weighted average. And so overall, it came out to 9% overall. And it's a weighted average of the higher participating plans.
So as an example, the Kaiser Senior Advantage Plan, the Medicare Advantage Plan, saw a year-over-year increase of 4.4%. It probably represents close to 50% of total enrollment. And with some of the other plans coming in at 12%, you put all those together, and that's how we end up getting a weighted average of 9% increase overall.
And we are asking to approve the continued admin fee of $8. We'll continue to draw down on the account as we did last year. But next year, we will definitely need to increase that admin fee. Are there any specific questions? We will stand for additional
Yeah, I
questions.
was a little surprised when there was no recommended change in that, since we kind of went through that battle, 3 or 4 years ago, and ended up, the board voted to do it, and then we decided not to do it because obviously the county wasn't happy. So, but I understand we're to that point where pulling money out of excess funds is going to run out. So
Correct. We've been continuing to communicate with the county in an effort to increase the admin fee, but because there's still funds in that account we still can use, this will definitely be the last year that we can do so. But we're working with them to find ways to fund that increase as opposed to just increasing it overall.
questions? I've got one for you, Steve, and it just has to do with putting on your prognosticator hat a little bit, but I would imagine it's still a little early to really get a sense of what the ACA cuts and subsidy reductions are going to really do to the overall healthcare world. What are your thoughts or your insights? How far in the future is it gonna be before we start seeing what I think is inevitable, but,
Interesting. I think we did a recent survey, and I think what we found is maybe a third of those surveyed plan sponsors thought that the reduction of subsidies will likely increase costs. 2/3 were going, we don't know. I think pragmatically, I think the issue is access to coverage help drive individuals to probably more appropriate sites of care versus an emergency room, urgent care, physician office, and treating chronic conditions. So again, it's really just, it's a shift in cost. So subsidies went to insurance coverage. If we remove the subsidies, people no longer have coverage, and they're likely to migrate to more expensive venues or postpone care. And so I think longer term, unless there's a change or kind of a significant difference made, we're likely to see that impact in the future, where you're going to see unreimbursed medical expenses at hospital facilities. That's going to necessitate increases in kind of negotiated fees, and that's going to increase costs kind of across the board. So it's, where we are, but it's like nobody knows. But the reduction in subsidies doesn't directly impact LACERA and LACERA's members. It's basically, it's happening elsewhere on that kind of three-legged stool in terms of distribution of cost sharing, but it's, not having coverage likely will increase costs at some point.
I mean, you read and hear reports what's going on around the country where people have seen their premiums triple, quadruple in some areas. So you have to wonder. I'd be a little bit more concerned if I were an active LA County employee than a retiree, because I think maybe the system is going to perhaps more negatively impact them than it will us because of who we insure. But I mean, I don't think for a second we're going to be immune from the fallout from some of this. And I just wonder how many of the companies out there are really afraid to give an honest response to a question like that out of fear of retaliation from the Beltway. So I don't know, but I think it's going to make for an interesting couple of years.
It is. And again, things tend to lag. So you do look at seeing the decisions like this pushed out 2 or 3 years in terms of where that goes. I think just using the pandemic, we had kind of a spike in cost and an absolute drop. And now we're kind of approaching increases that we have not seen in multiple years. And let's see if this is a new trend or if it's just an anomaly.
If there's no other questions, we'll take a motion to approve the 26-27 rate renewal proposal and mandatory contractual changes listed by carrier, and maintain LACERA's administrative fee at $8 per member.
So moved.
And I'll second it.
Ms. Langton,
Yes.
Mr. Kehoe.
Aye.
Mr. Pantoja.
Aye.
Chair Robbins.
Aye.
The motion passes unanimously.
Items for staff review, we have none.
We have,
Items for future agendas, none.
We have-
Mr. Robbins, we have 2 other items and the minutes.
Yeah, let me, wait a minute, what did I? Oh, yeah. Somehow I skipped that page. Item 5B, Cassandra, you wanna address item 5B?
There was nothing to report for the staff activity report.
Non-consent items would be.
Yeah, 5B non-consent, 2-year extension
Yes.
request for retiree healthcare
Sorry.
benefits consultant.
I'm thinking staff, like you got me off.
Okay.
We're requesting that we extend Siegel's contract an additional 2 years. As you know, we've been steadily involved with communicating, which they've been very instrumental in assisting us with getting the county to increase the lifetime maximum. Then we also have, we're considering changing our participation in the retiree drug subsidy plan and switching over to what they call an employer group waiver plan. However, that will require our plans to change from a fiscal calendar year to a calendar year, sorry, from a fiscal year to a calendar year. So we're requesting that the Siegel team be extended an additional 2 years because they're already familiar with our plan and program, which I'm sure the county will be looking to us for quite a bit of information to help them understand because it does impact their budget. However, we're considering this because the employer group waiver plan will allow us to collect more money for the county, on behalf of the county. Were there any specific questions other than that? That's the meat and potatoes of the entire request.
I move to accept.
I'll second it.
Ms. Langton,
Yes.
Mr. Kehoe? Mr. Keel?
Aye.
Mr. Pantola?
Aye.
Chair Robbins?
I'm an aye.
The motion passes unanimously.
Thank you, Cassandra. We're on item C, state engagement. Barry?
Yes, good morning, trustee Robbins and trustees. So this is a recommendation to approve, for the board to approve a visit by staff and trustees to visit the California legislature. We do this on an annual basis. One of the most important relationships we have that our prior state leg advocate helped us establish is with the retirement committee consultants. And I know that, one of them said that they're very appreciative that we make these, consistent annual visits. That we're the only 37 Act system that actually does this. So, and given, some of the changes at the executive ranks and so forth, this will be a good opportunity to just update, their staff and other legislators on what's going on with LACERA.
Any questions for Barry? No, I guess we need a motion on this.
Second.
We have motion and a second to,
Ms. Langton,
Yes.
Mr. Kehoe?
Aye.
Mr. Pantoja?
Aye.
Chair Robbins?
aye.
The motion passes unanimously.
Now on item 6A, semi-annual report. Mr. Liu, you're back up again.
Yes, thank you, Chair Robbins. Just a quick snapshot of activity during the last 6 months. So mainly it's about, we took positions last year on 2 bills, AB 1383, which deals with the PEPA compensation limit, which I have agendized for a fuller discussion at the Board of Retirement later. And then there was also a bill sponsored by SACRS that was sort of a technical omnibus bill. Other than that, it's, I'm on the SACRS Ledge Committee and we're continuing to, monitor legislation and have a bill coming up for this year that SACRS is sponsoring as well, which I'll agendize for the board to consider. But other than that, just a snapshot of the last 6 months. Happy to take any questions.
Thank you. Do you have anything under B as well?
No questions. I'll move on to the next item. Just a regular monthly engagement report with some items of interest. So we all know that California is the largest state in the country, and we're one, I think the 3rd or 4th largest retirement system in California. So this is just some interesting facts from the Public Policy Institute of California that looked at the population, who's moving in, who's leaving. As far as who's leaving has always been in the headlines in recent years. But for example, we have about 39.5 million people, and the Department of Finance projects that it'll grow to 39.7 in 2030 and about 40.5 in 2040. One of the things about the population growth is that it has slowed down compared to the rest of the country and had some effects here, particularly with what happened with the census. So as you know, in the 2020 census, California lost 1 congressional seat. And the projection is that based on the 2030 census, we might end up losing 4 congressional seats simply because of slower population growth here versus higher population growth in the rest of the country. Some interesting, statistics here. There's no race or ethnic group that constitutes a majority in California, although Latinos constitute a plurality. On the other hand, more than half of young Californians are Latino, whereas more than half of those over 65 are white. And then in terms of who's moving in, who's moving out, there's been net out migration, and most of the losses are among adults without college degrees. Higher income adults are less likely to leave the state, although remote work has enabled that. And then generally housing is the dominant reason that people are leaving California compared to, say, working family. The next item is about an interesting thing that's happening over at the Iowa Public Employees Retirement System. I think last month I reported that there have been these like state level DOGE, I guess, committees that have been looking at operations within various states. So in Iowa, the state DOGE report recommended that they make changes to retirement plans, such as moving away from a mandatory participation to allowing people to opt into either a DC or DB plan. So there's been some concern about that from public employee unions and also Democratic leaders in the state. So they're considering making a constitutional change that would constrain major structural changes to the IPERS and basically block any sort of future opt-in out system that could threaten the sustainability of the fund. And then the next item is about the New York City teachers. They're pushing for pension reform, although it's more of a, I would say, maybe a rollback from pension reform. As you know, a lot of retirement systems after the great financial crisis, made a lot of pension reform changes to their system. For these teachers, they had like a new tier, which is a tier 6, which required them to work until age 63 compared to age 55. So they're trying to, I guess, improve this to make it easier for people to retire earlier and also to improve retention and recruitment. And then lastly is an interesting, just another snapshot statistics from the National Association of State Retirement Administrators. Just some key points about our public retirement systems, state and locally. So in the US, a total of $6.25 trillion is held in public pension trust that covers over 15 million workers. And then if you look at California, let's see, we have about 73 billion that's paid annually to over 4 million retirees. Now, a lot of states, again, related to the last item, engaged in pension reforms after the financial crisis. So in 2010, about 18 states did so. In 2011, about 27 states. That's where you see most of the activity. And California instituted reforms in 2010, 2012, and 2014. And then, as we know, investments generally cover almost 2/3 of the benefit costs. With employer contributions at the remaining third. I'm sorry, employer contributions for the remaining third, and employee contributions at around 11%. And then also many plans since the financial crisis have started ratcheting down their expected investment returns. So currently, as of fiscal year 2023, it's about an average of 6.91% as an expected return. That concludes my report. Happy to take any questions.
Anybody have any questions? Yes, my next door neighbor works for Kaiser Permanente, and she's a radiologist at Kaiser Sunset. I was asking her about their strike, and she said it's not the money. They've been offered a pretty good pay raise over a 4-year period. They want to take away their defined benefit pension plan, and that's what it's all about. And that's why they are off. And she said that a lot of them ain't coming back to work until that's addressed. So, but good luck on that. So. Okay, item C, staff activities report.
You just spoke on it. There's nothing to report. We did get that yesterday, which Louis sent you an email yesterday letting you know that there's going to be a second open-ended strike with Kaiser. This one primarily affecting the pharmacies. I do understand that there will be some pharmacies closing, so members will need to check or utilize the mail order for their prescriptions.
How about labs?
Some of the labs are also being affected. Again, they would have to check. I know Kaiser sent out letters to some of the members to let them know, it's particularly for those that may have had appointments, to let them know whether
I
it
have
needed
one
to
on
be
Friday. I didn't get a
rescheduled.
letter yet. Though, so.
Then you should get a call if they hold true to their word.
Interesting. Item D, Michael, claims experience.
Good morning, Chair Robinson, trustees. The report has been updated through December 25. Most of the claims experience updated is more reflective of the 27-27 renewal. We have a couple items to discuss. This exhibit contains the Anthem claims experience by plan. And on an aggregate basis, the year-over-year trend increase is 6.8%. For the non-Medicare plans, which includes plans 1, 2, and prudent buyer, the year-over-year increase is 2%, which is below the non-Medicare benchmark trend of 8.6%. And for Plan 3, which is a Medicare supplement plan, the year-over-year trend increase is 13%, which is above the Medicare benchmark trend of 8.1%. There's largely attributable to most of the costs residing from pharmacy claims. And then the next exhibit.
Let's go back to these. So for perspective, the experience we're looking at is perspective. So it's basically what's going to impact next year's renewal, not what we've just concluded. So this is really kind of giving you a sense of where the experience is trending currently, and we'll continue to monitor that month to month.
And the next item tracks the members at risk of reaching Anthem's lifetime maximum benefit of $1.5 million. From a calendar year to calendar year comparison, members at risk are relatively consistent. As of December of 2024, there were 42 members at risk. As of December of 2025, there were 41 members at risk. Thank you.
Okay. You know, when I was looking at the new numbers for the premiums, and I'm looking at what the two-party rate for the Anthem Blue Cross 2 is, which is what I'm in, and it's $3,200 a month. And I was just thinking, all these county employees that are in tier 2, that are gonna have to pay the difference between the single party rate and the 2 or 3 party rate are in for a real shockaroo. They better be saving a whole lot of money between, save all that overtime that they're making, because it's gonna be real sobering. I don't think they really see that, but when I'm looking at what my premium is, knowing that I have 25 years of county service and it doesn't cost me anything, and then you look at the people hired after 2013 and you're going, wow, that is gonna be a very bitter pill to have to swallow. So, different world. Steve, you're up.
I have 2 informational items. The first is a compliance news update. U.S. Departments of Labor, Health and Human Services have published or proposed a new rule on healthcare price transparency. Some rules that had previously existed, but to be quite honest, some material that was required to be published really wasn't accessible to individuals. And so some of the revisions are basically geared to allow members to kind of see what the cost of service is by different facilities, et cetera. So it's a proposed rule, we'll see where it goes and lands, but that's just informational there for you. Your insurance carriers are going to handle up those responsibilities, so there's nothing for LACERA staff to do. The last item is a trend update that Siegel publishes. We publish 4 per year. This one's on the impact of musculoskeletal conditions. Certainly a cost driver for most plan sponsors. Again, for retired population, that's going to be a little bit more pronounced. Key issues are kind of making sure the site of care is appropriate. We're seeing a lot of surgeries now are moving to ambulatory service centers instead of it being inpatient. So that has a dampening effect on the cost in the short term, but once that kind of plateaus and you see those costs rise again, we're seeing the introduction of some digital therapies or resources like physical therapy that can be done from home using apps, et cetera. So it's kind of trending in that direction. So it's, again, we're just trying to make things more accessible to members. Again, your vendor partners, Anthem, Kaiser, et cetera, are all working to integrate kind of best practices to kind of help kind of improve the quality of life and help to kind of maintain some cost controls. But that's in there for your packet, and I have nothing else to add.
Anybody have any questions for Steve? Now we get to item 7, items for staff review. Terry?
Mr. Robbins, we need to return and vote on the minutes.
Okay, we'll back up and we will, now that we have a forum. Do I need a motion to approve the minutes of December 3rd?
I'll move it.
I'll second it.
Ms. Langton,
Yes.
Mr. Kehoe,
Aye.
Mr. Pantoja, Chair Robbins.
I'm an aye.
Motion passes with 1 abstention.
And a motion to approve the January 7th minutes.
So moved.
I'll second it.
Ms. Langton,
Yes.
Mr. Kehoe,
Aye.
Mr. Pantoja, Chair Robbins.
I'm an aye.
The motion passes with 1 abstention.
Now we're on.
Now we're on 7. And yes, there's nothing.
Good times, your charm. And nothing for future
Nothing for
agendas.
future agendas.
We'll skip go to the order and do it during the board meeting. Anybody have anything that they want to say? Motion to adjourn.
We could have done it.